In a press conference currently being held by the World Health Organization, of course, giving the world these daily updates. We have there on the screen for you now the WHO Director General.
Dr. Tedros will provide some opening remarks, then we'll open it for questions. I'd like to remind you we can only have one question per journalist. We've got limited time. This is a very busy time for everybody, so please respect that. There are a lot of you, and we want to give everybody a fair chance. Now over to you, Dr. Tedros.
Thank you, Margaret. Good morning, good afternoon, and good evening, wherever you are. Every day, COVID-19 seems to reach a new and tragic milestone. More than 210,000 cases have now been reported to WHO, and more than 9,000 people have lost their lives. Every loss of life is a tragedy. It's also motivation to double down and do everything we can to stop transmission and save lives. Of course, we have good news today. Yesterday, Wuhan reported no new cases for the first time since the outbreak started. Wuhan provides hope for the rest of the world that even the most severe situation can be turned around. Of course, we must exercise caution. The situation can reverse, but the experience of cities and countries that have pushed back this virus give hope and courage to the rest of the world. Every day, we're learning more about this virus and the disease it causes. One of the things we're learning is that although older people are the hardest hit, younger people are not spared. Data from many countries clearly show that people under 50 make up a significant proportion of patients requiring hospitalization. Today, I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else. I'm grateful that so many young people are spreading the word and not the virus. As I keep saying, solidarity is the key to defeating COVID-19. Solidarity between countries, but also between age groups. Thank you for heeding our call for solidarity, solidarity, solidarity. We have said from the beginning that our greatest concern is the impact this virus could have if it gains a foothold in countries with weaker health systems or with vulnerable populations. That concern has now become very real and urgent. We know that if this disease takes hold in these countries, there could be significant sickness and loss of life. But that's not inevitable. Unlike any pandemic in history, we have the power to change the way this goes. WHO is working actively to support all countries, and especially those that need our support the most. As you know, the collapse of the market for personal protective equipment has created extreme difficulties in ensuring health workers have access to the equipment they need to do their jobs safely and effectively. This is an area of key concern for us. We have now identified some producers in China who have agreed to supply WHO. We are currently finalizing the arrangements and coordinating shipments so we can refill our warehouse to ship PPE to whomever needs it most. Our aim is to build a pipeline to ensure continuity of supply with support from our partners, governments, and the private sector. I'm grateful to Jack Ma and his foundation, as well as Aliko Dangote, for their willingness to help provide essential supplies to countries in need. To support our call to test every suspected case, we're also working hard to increase the global supply of diagnostic kits. There are many companies globally that produce diagnostic kits, but WHO can only buy or recommend kits that have been evaluated independently to ensure their quality. So we have worked with FIND, the Foundation for Innovative New Diagnostics, to contract additional labs to evaluate new with companies to secure the supply and equitable distribution of these tests. And we're also working with companies to increase production of the other products needed to perform the tests, from the swabs used to take samples to the large machines needed to process them. We're very grateful for the way the private sector has stepped up to lend its support to the global response. Just in the past few days, I have spoken with the International Chamber of Commerce, with many CEOs through the World Economic Forum, and with the B20 group of business leaders from the G20 countries. We understand the heavy financial toll this pandemic is taking on businesses and the global economy. We're encouraged by the solidarity and generosity of business leaders to use their resources, experience, and networks to improve the availability of supplies, communicate reliable information, and protect their staff and customers. And we're also encouraged that countries around the world continue to support the global response. We thank Kuwait for its contribution of $40 million. In addition to increasing access to masks, gloves, gowns, and tests, we're also increasing access to the evidence-based technical guidance countries and health workers need to save lives. WHO has published guidelines for health ministers, health system administrators, and other decision makers to help them provide life-saving treatment as health systems are challenged without compromising the safety of health workers. The guidelines detail actions all countries can take to provide care for patients, regardless of how many cases they have. They also outline specific actions to prepare health systems according to each of the 4 Cs: no cases, sporadic cases, clusters of cases, and community transmission. These guidelines provide a wealth of practical information on screening and triage, referral, staff supplies, standard of care, community engagement, and more. We encourage all countries to use this and many other guidelines, which are all available on the WHO website. But we're not only advising countries, we also have advice for individuals around the world, especially those who are now adjusting to a new reality. We know that for many people, life is changing dramatically. My family is no different. My daughter is now taking her classes online from home because her school is closed. During this difficult time, it's important to continue looking after your physical and mental health. This will not only help you in the long term, it will also help you fight COVID if you get it. First, eat a healthy and nutritious diet, which helps your immune system to function properly. Second, limit your alcohol consumption and avoid sugary drinks. Third, don't smoke. Smoking can increase your risk of developing severe disease if you become infected with COVID-19. Fourth, exercise. WHO recommends 30 minutes of physical activity a day for adults and 1 hour a day for children. If your local or national guidelines allow it, go outside for a walk, a run or a ride, and keep a safe distance from others. If you can't leave the house, find an exercise video online, dance to music, do some yoga, or walk up and down the stairs. If you're working at home, make sure you don't sit in the same position for long periods. Get up and take a 3-minute break every 30 minutes. We will be providing more advice on how to stay healthy at home in the coming days and weeks. Fifth, look after your mental health. It's normal to feel stressed, confused, and scared during a crisis. Talking to people you know and trust can help. Supporting other people in your community can help you as much as it does them. Check on neighbors, family, and friends. Compassion is a medicine. Listen to music, read a book, or play a game. And try not to read or watch too much news if it makes you anxious. Get your information from reliable sources once or twice a day. To increase access to reliable information, WHO has worked with WhatsApp and Facebook to launch a new WHO Health Alert messaging service. This service will provide the latest news and information on COVID-19, including details on symptoms and how to protect yourself. The Health Alert service is now available in English and will be introduced in other languages next week. To access it, send the word "Hi" to the following number on WhatsApp: 0041 798 931 892. We will make this information on our website later today. COVID-19 is taking so much from us, but it's also giving us something special, the opportunity to come together as one humanity, to work together, to learn together, to grow together. I thank you.
Thank you, Dr. Tedros. I'll now open the floor to questions. Well, we don't have a floor, but I'll open the virtual world to questions. And first in the very long queue is Chu Liu from Geneva. Chu, can we please have your question?
Hi, can you hear me? Hello?
Yes, we hear you very well.
Hi, it's Liu from China's Xinhua News Agency. Almost a week from now, G20 countries will be at a meeting to discuss the COVID-19 and the heavy impact on the global economy. And my question is, now China has reported no new cases since yesterday. So what does it mean? What does it mean for China? What does it mean for the rest of the world? And what are the difficulties lying ahead for China in combating this global pandemic? Thank you.
I think the simple message, and echoing the Director General's comment, is it's a message of hope. It's a message that this virus can be suppressed. We can break chains of transmission. It takes a huge effort. It takes an all-of-society effort. It takes coordination. It takes solidarity. It takes activated communities. It takes brave health workers. It takes supply chains that work. It takes commitment. And if it's done, this virus can be turned around. Other countries are showing the same thing, and not by doing exactly the same thing. They're achieving the end by mixing and matching and creating a comprehensive strategy that's matched to the threat they face and to the context in which they're working. So I think there's a message of hope there from China. And that's a message of hope to many countries around the world who have very low numbers of cases right now. and who can turn this virus back. We've seen the damage this virus is doing in health systems in a number of countries, but we've also seen that this virus can be pushed back. So that's I suppose the implication that we see for this. But it's going to take time, it's going to take effort, and it's going to take solidarity, and it's going to take coordination at community level, at government level, at international level to make this happen. There was no specific question.
Thank you very much. I'll now hand it over to Badia from Nauruz in Iran.
Hello, can you hear me?
Very well. Please go ahead.
I asked this question before in a one-on-one interview with Dr. Ryan. I'm asking Dr. Tedros, as we know, today is the Iranian New Year, which means a new day. It is the very first day of spring in Northern Hemisphere, spring equinox. Many people in Central Asia, Western Asia, they are celebrating it as a sign of renewal, a new beginning. In this climate, what will be the WHO's message to people who are celebrating Nowruz, especially Iranian, who are among people struggling the most with the outbreak of COVID-19?
We missed your question, but was that really about temperature? Are you talking about celebrating the spring?
Hello?
Dr. Ryan will answer.
Yeah. Hi, Badia, and I trust you had a safe trip back to Iran. We miss you in Geneva. I think, you know, it's celebrations and gatherings, particularly religious gatherings and ones that celebrate renewal, are obviously very important. But we may need to change the way we celebrate things. For now, and in countries like Iran, and it's very clear from the government that in Iran, we have to separate people physically so we don't transfer disease. And mass gatherings, particularly mass gatherings that bring people from far away to one place, and they mix and then they go again far away, and that's very often religious gatherings, they can not only amplify the disease, but they can disseminate the disease very far away from the center. So they can be very, very, very dangerous in terms of epidemic management. We see the authorities in the Kingdom of Saudi Arabia, how careful they have to be every year with the Hajj because of the health risks, and that's managed extremely well. But in this particular case, with this virus, with this seriousness, I think we need to heed the instructions from the government in Iran. We need to heed instructions all around the Middle East that the gatherings of a certain size, and they're different size in each country, need to be avoided, and we would support the government's efforts on that. But as we've seen, and it's not just in Iran where we might have religious gatherings, we have other gatherings around the world, young people gathering, as the DG has said, and other people coming together. So whatever reasons we have to come together, and there can be very good reasons, we need to listen to local authorities, we need to listen to national authorities, and if national authorities believe that those gatherings represent a risk to those individuals, but more importantly to the vulnerable people they will go to visit after the gathering, then I think we really do have to take it upon our own personal responsibility. This is not about the responsibility of government. This is about each individual making a decision to protect themselves and protect others. We shouldn't always have to have a government telling us to do that. This is about personal responsibility. But in the case of mass gatherings in the context of countries like Iran, I think we need to be exceptionally careful at this point, and we need to be very, very careful not to bring too many people together too closely at any one time.
All right, so we're cutting out, that was a live briefing from the World Health Organization. Starting there, the Director General with the death toll from COVID-19 now around the globe. More than 9,000 people, he said, have succumbed to the disease. That was the bad news. The good news, he said, Wuhan in China, where this all originated, reporting no new cases for the first time. So an encouraging bit of news there for countries that want to push back the disease and and that was the message coming through, that it is possible at a certain number of cases before health systems are overwhelmed to push back COVID-19 through these measures. The last they're talking about avoiding gatherings, and we know in South Africa, of course, anything above 100 now banned. Now let's look at